The new coronavirus variant first reported in southern Africa. The World Health Organization has named it Omicron and declared it to be of concern. Scientists identified the variant on Thursday. Cases have already been reported in Israel, Belgium, Botswana, and Hong Kong. The WHO said Omicron has a large number of mutations and may spread more quickly. Early evidence also suggests an increased risk of reinfection. This has triggered global alarm. Countries including the United States, Canada, and the United Kingdom, along with the European Union, have rushed to limit or suspend travel from southern Africa. Stock markets on both sides of the Atlantic have suffered the biggest falls in more than a year. The WHO, though, has cautioned countries against hastily imposing travel restrictions, saying they should take a risk-based and scientific approach.
There's little known about the new COVID-19 variant B.1.1.529, which has caught scientists in South Africa by surprise.
There seems to be more than 50 mutations compared to the original virus, and more than 30 of these are in the area of the virus that we are concerned about. That is the area that interacts with the human cells that causes infection. And also that is the area of the virus that vaccines, for example, may target. And so if those areas have changed, vaccines may not work as well as they would have worked before.
The new strain is spreading rapidly. Close to 24 cases have been detected, most of them in the Gauteng province.
I'm very worried about the new variant, and I'm not sure if we're gonna survive this one this time around. It's very stressful because now we have stopped attending classes. Like, we had contact classes, but we are no longer attending. And we cannot go home as well.
It makes me feel so sad, so frustrated, so anxious, because I feel like everything is just stopping my future, stopping everything, everybody's future.
Travel to and from South Africa has been banned by several European countries. The United Kingdom had only recently removed South Africa from its red list after the third wave subsided in October.
There is no country which would want to have a new variant. And we fully understand when countries ban South Africa. Obviously, bad news for us because it's just before the festive season and people have booked their tickets to come here. And there is not enough domestic tourists to cover the entire tourism value chain.
President Cyril Ramaphosa will, with his command council on Sunday, decide the way forward. Another strict lockdown will hurt the economy and worsen a staggering 35% unemployment rate.
We might actually get a situation where the borders might be closed. The internal borders within South Africa might be closed because of trying to stop the spread of this new variant. Obviously, it's unfortunate, but I think the most important thing is that South Africa comes first before tourism comes first.
It's unclear for now if this new variant may cause a more severe strain than Beta and Delta that drove South Africa's second and third waves. Hospitals are, however, preparing for the worst. For South Africans traveling home, it could mean another bleak Christmas if restrictions are tightened and plans have to be put on hold. Julie Shara, CGTN, Cape Town, South Africa.